In this video we will explain to you how each role within the provider office will be affected by ICD-10. Let's first look into the front desk changes. Privacy policies must be revised and patients will need to sign the new forms. System changes. Updates to systems may impact patient encounters. Now let's look into changes faced by physicians. Physicians must be trained, as code increases from 17,000 to 140,000. The need for specificity dramatically increases by requiring laterality, stages of healing, weeks in pregnancy, episodes of care, and much more. Next, let's look into changes affected in the role of nurses. In forms, every order must be revised or recreated, documentation must use increased specificity, and policies change requires training and updates. Now, let's look into the changes in role of lab technicians. Must use increased specificity in documentation. Health plans will have new requirements for the ordering and proper reporting of services. Now let's look into clinical changes affected by ICD-10. Patient coverage changes include health plan policies, payment limitations, and new ABN forms. Revisions required and paper superbills may be impossible. ABN forms must be reformatted, and patients will require education. Next is changes affected in coding. Codes will increase from 17,000 to 140,000. As a result, code books and styles will completely change. More detailed knowledge of anatomy and medical terminology will be required with increased specificity and more codes. Coders may need to use ICD-9 and ICD-10 concurrently for a period of time until claims are resolved. Next, let's look into changes affected in billing section. All payer reimbursement policies may be revised. Billing department must be trained on new policies and procedures and the ICD-10 centimeter code set. Lastly, let's look into changes affected at managerial level. Any policy or procedure associated with a diagnosis code, disease management, tracking, or PQRI must be revised. All contracts must be evaluated and updated. Changes to software, training, new contracts, and new paperwork will have to be paid for. Want to solve ICD-10 related problems? Contact Clinic Spectrum, empowering cost-effective workflow. Follow us on Facebook and Twitter, or give us a call on 908-834-1608. Thank you for watching.